Good morning, I am Roshan Sheikh. The overall aim of the program is not only to improve the Achilles tendon function but also to enhance glycemic control, reduce blood pressure, support weight loss, improve CV fitness, and increase confidence to maintain long term physical activity. Today we are focusing our session with warm up, main session, and cool down. For the warm up, we will be doing the exercises such as marching on spot, heel raises, and ankle circles. These warm up exercises are helpful in activation of calf muscle and reduce the stiffness of ankle and increase and improve mobility according to the ACSM 2022 guidelines. Firstly, we will start with wall push-ups. So during this, the patient stands against the wall and place hands approximately shoulder width apart at shoulder height. So patient takes a step backward, so his body is slightly inclined forward. He keeps his body in straight line and slowly bends elbow and brings chest close towards the wall. By using his both hands, he pushes his shoulders and chest back and goes back to the starting position. During this exercise, we have to tell the patient to maintain controlled breathing throughout the exercise and how he is doing and check his breathing pattern. We have to check if he is whether maintaining neutral spinal position so that he don't spin and his hips move excessively. During this exercise, we tell the patient to do 2 sets with 12 repetitions in each. The wall push-ups helps in upper body strengthening, core activation, and it increases overall muscular endurance. So now going to the progression, if the patient is able to do the normal wall push-ups, we will tell the patient to for the progression we will tell the patient to do knee push-ups and the normal push-ups like it is shown in the video. And during the normal push-ups also he has to maintain his structure and posture correctly. And coming to the observations, we during the exercise we have to monitor the breathing pattern and the rate of perceived exertion, shortly RPE. The RPE measures physical activity of the body during an exercise. So the scale of RPE can be measured in 1 to 10. 1 means very light activity, 4 to 5 means moderate, and 10 maximum effort according to the 2009 ACSM. So next exercise is gluteal bridge. To begin this exercise, we tell the patient to lie on his back on the floor with knees bent and feet flat on floor. We tell the patient to position feet approximately hip width apart with heels placed comfortably in front of his knees. From this position, we tell the patient to gently engage his abdominal muscles and squeeze his glutes. Then lift hips from floor until his shoulder, hips and knees are approximately and properly aligned. At the top of the movement, we tell the patient to hold briefly for a few seconds while maintaining a controlled contraction. And we have to observe and tell the patient to avoid excessive arching of his lower back, and we tell him to slowly lower his hips back to the floor. So in this exercise the patient performs 3 sets with 7 repetitions in each and with a holding time of 10 seconds for every repetition. This is helpful in strengthening the posterior chain, improving walking mechanism, and reduce unnecessary stress and strain on the Achilles tendon. Because this exercise recruits large muscle group, it also increases energy expenditure and supports glycemic control. During the exercise, I monitor the patient's continued breathing normally, so to avoid unnecessary increase in blood pressure. For the progression, I will increase the holding time from 10 seconds to 15 and later on to 20 seconds. The exercise is done according to the reference of American Diabetes Association Professional Practice Committee 2025. The next exercise is sit to stand. To begin this exercise, we tell the patient to sit on a chair with feet in hip width and positions his feet under his knees. We tell the patient to lean his trunk slightly forward while maintaining control through lower limb. Then push his push through his feet and extend hips and knees to stand up. Then he will return back to his seat position, slowly bending his hips and knees in the controlled manner. Throughout the exercise, we tell the patient to look straight forward without breaking his without excessive movement on his head. This is a functional exercise that mimics everyday activities while strengthening major lower limb muscles such as quadriceps, gluteus muscles, and calves. So it helps in improve insulin sensitivity and contributes to weight management. So during the exercise, we can also check the RPE according to the reference of CJ Jones 1999. As you see in the video, for the progression, we will give the patient a kettlebell which will add an extra weight and it will help him strengthen him more. And for the regression part, we will give patient a support by holding his hands from standing in front of him, and it will give him enough stability and enough support to do the exercise without fear of losing his balance. Now we go to step ups as our next exercise. We start this exercise by standing in front of a stable step or platform. Then we tell the patient to place one foot fully onto the step, ensuring the entire foot is supported. From this position, the patient pushes through the foot on the step and extend the hip and knee to bring the opposite leg up onto the platform. Then he slowly lower himself back down to the starting position, controlling the movement through hip, knee, and ankle. For the step ups, we will do 2 sets with 10 repetitions in each set per leg. The step up is a functional closed chain exercise that progressively challenges lower limb strength and weight bearing capacity. This is helpful in increasing cardiovascular demand while strengthening the hips and legs. This contribute to improve blood pressure and enhance and better the glycemic control and increase calorie expenditure. During the activity, we can monitor the RPE and tag test, which helps to identify if he is comfortable to do the activities or not. So, if he is facing any problems in doing it, we can, or facing any discomfort, we can provide some rest to him according to the reference of ACSM 2022. And for the progression, as you see in the video, we increase the step height and we will tell him to do the same pattern. The next exercise is heel raises. We begin this exercise by telling the patient to stand with feet approximately hip width apart. From this position, the patient slowly raises his heels by pushing through the forefoot and lifting heels from the floor. Now the patient completely stands on his toes and slowly go back to his neutral position. So during this exercise, progressive calf loading is essential following Achilles tendinopathy because tendon respond positively to gradual loading. So for this exercise, we tell the patient to do 3 sets with 12 times repetitions in each. We can program the exercise to single leg heel raises, or we can progress the exercise to single leg heel raises. The exercise activates the gastrocnemius and soleus muscles, which improves tendon stiffness and increase ankle mobility and stability. During this activity, I will monitor the pain and I will check whether the patient is feeling any mild discomfort of up to 3 by 10 on a pain scale, which is acceptable for tendon loading. And I will also observe the breathing and check if he is doing good in the RPE scale according to the Barton Sports Medicine 2013. For the progression, the single leg heel raises can be done. So we tell the patient to take support from the wall and take and lift one of his legs and do it the same as 3 sets in 12 repetitions in each for each leg. So during the progression also we do the same observation. We observe his breathing pattern and if check if he is feeling any discomfort, and we can do the talk test also. For the regression, we will tell if patient is unable to do the normal single or double leg heel raises, we will tell the patient to go for regression, and for the regression we will tell him to, or we will give a chair or any height object for his support, which will help him control his stability and improve his exercise. So in the regression, the patient takes support from the chair and lifts his both heels into the air and stand on his toes. Heel raises are directly relevant to Achilles tendon rehabilitation because they progressively load the plantar flexor muscle tendon unit, according to Silvernagle. The follow-up exercise is resistance band exercise. We begin this exercise by telling the patient to take a seat on a chair, on a stable chair, comfortably. We explain the resistance band and how it works to the patient, and we tie the resistance band around the forefoot or the toe, and the other end of the bands will be held in both of his hands. So we start the exercise by the toe relaxed and pointing towards the patient. Then slowly push the toes and foot against the resistance band. Then return the foot slowly to the starting position. This exercise can be performed in 2 sets and each set for 12 repetitions. It can be used to develop balance, ankle strength, and improve control of ankle complex, according to the reference of Phillips 2026. So for the progression, we change the colors of the resistance band, which in turn gives more resistance on his foot, and we increase the holding time of the toe where he supports the or supports and stresses against the resistance band. We increase the holding time from 5 seconds to 10 seconds and later on to 15 seconds. During this during this exercise, we observe his breathing pattern. Now we will tell the patient to do the brisk walking, which is a primary aerobic exercise. This should be performed 5 to 10 minutes, and this can be progressed weekly. This activity helps in lowering the blood pressure, weight loss, and cardiovascular fitness, and improves overall confidence. So this exercise is strongly recommended for a managing type 2 diabetes, hypertension, and obesity. During this exercise, we can monitor the patient and moderate intensity using both the talk test and RPE, and observing the walking pattern and any signs of excessive fatigue, to the reference of WHO 2020. The next cardiovascular exercise is static cycling. Here, before we tell the patient to start, we adjust the seat height so that his knee remains slightly bent. The patient places both his feet securely on pedals and begins cycling comfortably. We tell the patient to maintain smooth, controlled rhythm and avoid immediately using high resistance, particularly during early stage of rehabilitation. It is useful during rehabilitation because it provides a low impact method of maintaining cardiovascular fitness and lower limb movement. For the duration, we start by doing 5 to 10 minutes every day, and for the progression, we will increase the resistance for the cycling. And during the whole process of cycling, we observe his breathing pattern, and we do the RPE test, and we do the talk test while talking with the patient to find any discomfort or any change in the breathing pattern. During the exercise and after the exercise, we monitor his heart rate by checking his pulse, and we can also suggest him using wristwatches, the smart watches that help read his heart rate in real time during the exercise. After the main exercises, we will follow up with the cool down exercises for 5 to 10 minutes. The cool down exercises are slow walking, which will be we can do it for 3 to 5 minutes, calf stretches, 2 repetitions per leg, and 20 to 30 seconds for hold, and deep breathing exercises. The benefits of cool down exercise are safely bringing the patient's heart rate and body temperature back to normal, and preventing dizziness and fainting, and lessening any other post workout injuries. So It aids in mental health recovery by lowering stress hormone and aids relaxation, according to the reference of ACSM 2022. Thank you.